Good afternoon, everyone, and I'm delighted to be asked to participate in this World Cancer Day webinar on lung and bowel cancer. My name is Padraic Mac Mathuna. I'm the Clinical Director of the Bowel Screen, which is the National Colorectal Cancer Screening Programme as part of the National Screening Service. And again, it's very important that I think that this significant cancer, including as well as lung cancer, is highlighted today. And I really appreciate the Irish Cancer Prevention Network with its 5 agencies all supporting this event. My task really is to highlight the importance of recognizing early bowel symptoms and also then to give you an overview of the Irish Colorectal Cancer Screening Programme, or Bowel Screen. The National Screening Service, or what does it do? Well, currently it is a screening program for three cancers: bowel, breast, and cervical, as well as a screening program for individuals with diabetes, where they have their retinal screen in an attempt to prevent blindness. And screening is important to aim to find early signs of disease. It's essentially for people who do not have symptoms, and that's an important distinction between individuals who are entirely well as opposed to having symptoms. And the whole concept of screening is to find early disease before the person has symptoms, intervene, and therefore prevent the progression of disease and reduce the mortality. As regards bowel cancer, there are some very important facts to keep in mind. The bowel, or the large intestine, includes both the colon and the rectum. And almost 3,000 people a year are diagnosed in the country. It's the second most common cancer in men and third most common cancer in women, I think, which is under-recognized. And most people develop the disease after the age of 60, and about 1,000 people a year die from this disease. So it's an important public health issue. We feel that the number of cases may increase in the next 10 years as people get older, which is the same for all disease, including all cancers. So therefore, screening has a potential important role in making an impact on the potential mortality from this disease. So let's look at the early signs and symptoms that people should be aware of and bring to their attention of their general practitioner. And again, this includes both people who've had a screen test or not. And symptoms can develop between screens. And again, just to emphasize, the screening is for individuals who do not have symptoms. And I clearly mentioned already that if the screening, the emphasis on screening is finding early disease or pre-cancer disease that we can intervene on. If you have a change in bowel habits, again, over a period usually of 4 to 6 weeks, if there's a feeling that you haven't emptied your bowel properly, if you have pain, unexpected and prolonged pain, feeling very tired, which may reflect anemia, or like shortness of breath, likewise, which may reflect anemia, or if you've had unexpected rectal bleeding, all of these require attention, and they should trigger a visit to your GP, who then can make the decision whether you need to have further tests or not. And this is entirely separate from the screening program. So how does the bowel screen program work for you? Well, if you're between the ages of 59 and 69, you'll be included in the program, and the first home screening test will be sent out to you between your 59th and 61st birthday. And this is important because up until last year, the entry age was 60, and we've reduced it by 1 year now, and we'll continue to reduce it in the coming years. The test will be offered as a home test every 2 years, and you need to be on the bowel screen register to receive an invitation. And how to get on the register and how you're contacted is available again through the helpline and websites that we'll highlight at the end of this talk and throughout the afternoon. You'll receive an invitation to take the home test kit, and if you accept, the test will be posted to you to your home address. This is a simple little test that you should leave beside the toilet in your bathroom, And when you're having a bowel motion, a small sample of your stool is taken with a specific little stick. It's put into the little container that you can see on the right-hand side, into a self-addressed envelope, and then sent back to the laboratory. And this tests whether there's any invisible blood in your stool that wouldn't have been apparent to you. And in turn, if that is the case, then we can offer further screening tests. So the test comes back to the central laboratory, and that will tell us whether there's traces of blood in the stool or not. And again, we can send the results back to you at home within 4 weeks. The vast majority of people get a normal result, over 95%. In other words, no detected blood. And if you're between those ages of 59 and 69, you'll be asked to retake the test in a couple of years' time. Again, emphasizing the fact that in the meantime, if you develop any symptoms that we mentioned earlier on, it's important to go to see your doctor regardless of the fact that you're in the screening program. This is important because the screening program is not foolproof. The abnormal test, the presence of blood may be intermittent, and therefore when the test is taken, you may or may not be having some bleeding, and therefore it's limited. It has limitations in terms of accuracy. If you get an abnormal test, we'll invite you for further test called colonoscopy, and that will be carried out in the local in your local hospital, depending what part of the country you live in. So colonoscopy is an examination of the colon, and this is a photograph of a typical endoscopy unit in the country where the person is sedated, asleep on the trolley with two nurses and the endoscopist. And the thin tube is placed in through the rectum, and it navigates through the colon, and the picture is up on a video screen. And it looks for signs of precancer changes called polyps, or in fact, cancer. And just to reiterate, if 100 people have a colonoscopy, we find cancer in about 3 to 4 people, but we find up to 50 people have polyps. And the polyps are the small growths which we remove because they're the precursors, or they're the changes in the bowel that in turn may go on to cancer. So this is a valuable exercise in taking away any pre-cancer changes in the bowel. And again, in general, if 100 people have a colonoscopy following a positive FIT test, we found about 50 people, about 50% have polyps. So this is a valuable test. After the colonoscopy, we usually have a chat. All the in the endoscopy units, the nurse and the doctor will have a chat with you about the result. The vast majority of people will have a non-worrying result, either normal, or if the polyps have been taken out, then a surveillance plan is made for you on the day. In the small number of people who have cancer or significant large polyps that require further surgery, then referral is made on through the nurse specialists for you to have further tests with a view to seeing the oncology and surgical colleagues. But again, it emphasized that the majority of individuals who have cancer found during a screening colonoscopy test have an excellent outcome. Up until this year, we included people between 60 and 69, but it's important, according to the national strategy, to gradually reduce this age slowly towards 55. Like everything in relation to screening, it's your choice, and there are some additional help in terms of websites, videos, and in multiple language, given that we're a multicultural society. And again, most of this information available online is easy to understand, and it definitely should address any concerns that people have about participating in the screening program, including what's involved in the FIT test, the potential for colonoscopy, and the fact that it's a positive step in terms of cancer prevention. So just to summarize the program, if you are 59 or older up to the age of 69, you'll receive an invitation to participate. And we've reduced the initial age from 60 to 59 last year, and we'll continue to reduce it towards mid-50s in the coming years. As I say, if you're not on the register and haven't been contacted, it's simple to get on the register by calling the free phone number here or registering through the bowel screen website. We'd encourage you to participate in the program. And once you get the fit test, to put it beside the toilet at home. The sample collection from your stool at home beside the toilet is simple. Put it into the little container and send it off in the post, and we'll come back to you with the result in a few weeks. So these are the points of contact with website, email, free phone. All the information is there. In our view, I think it provides a level of reassurance of what the program involves, the target population, the potential outcome, and the fact that this is a positive public health measure in reducing the mortality from colorectal cancer, improving the health of the population, particularly both men and women over the age of 60. So thank you very much for your attention, and we will be able to participate in a question and answer session later on.